If you could change one thing in the healthcare system today, what would you do?
Put the patient back in the center. Bring the patient back. Because we've lost that.
Can you explain that a little bit? I mean, how do you, you go into the doctor's office and you sit on the examining table and you're sort of, you think that you're in the middle of this and probably not. So how do you put the patient back in the middle of this?
Well, first of all, for one thing, in order to have insurance properly dealt with, you have to have a diagnosis. Mm-hmm. And the diagnosis has to fit into some kind of a code. And so if you can't fit the patient into that kind of a code, then what does a doctor do? You have to find something. For years, I struggled with that because I thought, I'm really not telling the truth here, because I know that there's underlying problems here that are more important than what I'm putting down here. But I have to put this down because this is what's understood by the codes that take up the codes that pick up this. So where is the patient in that? You have to put that aside in order to do this. So we have to get to the point where what the patient tells me or I observe by working with the patient is pivotal. If I, say for instance, I tell a person to do some kind of medication or something, and they tell me they get or they have a reaction to it. Mm-hmm. If I don't pay attention to that's really stupid, mm-hmm. because that's where the healing happens, is with what the patient is doing and how they accept it and how they, as an individual, are dealing with the disease process, plus what it is that I'm trying to do for them. So putting the patient back into the center of the whole healing process, I think, is what has to happen. And that means that life has to come back into it. So we have to put our focus, if a healing procedure enhances life, like acupuncture, like homeopathy, like the herbal medicines, like the stem cell, like my hip replacement. If the therapeutic procedure enhances life, then it's part of living medicine, because for that person, that makes life better. Just like, for instance, I had a patient that she had lung cancer, and she'd had all the therapies and so on, and she called me up and she said, they tell me I have to have a blood transfusion, I don't want it. And I said, well, why not? Well, she's afraid of AIDS and hepatitis, which is, of course, silly because she's dying of cancer. But when fear steps in, reason steps out, and no matter what I tried to explain to her, she couldn't get it. She was just afraid of that. Until finally I said to her, well, maybe you could look at it this way. You know what a blood transfusion is? Some person in this world loved you enough to give their life blood for you. That's what a blood transfusion is. So when she was able to take her energy off of fear and put it onto love, she was able to get the blood transfusion. It didn't cure her cancer, but she lived another 6 months more involved with life because of the blood transfusion. So it's taking the patient and putting them back in the process, instead of just saying, well, you need a blood transfusion. If you don't get it, you're going, whatever.
I actually feel more alive now than when we started the conversation. So thank you.
Well, thank you
very much for the privilege of getting to talk with you like this. And I'm so glad that Natural Partners can help share your message. And I'm so grateful to you for making Natural Partners happen.
Isn't life wonderful?
Whatever magical way it is.
Isn't life
yes,
wonderful?
It is.
Yeah.